Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers. Filling in for your host Warren Zeisman this month, Joanna O'Neill.
Good morning, everyone, and welcome to another edition of Healthcare Sunday on KJUL 104.7 FM, the Jewel of the Valley. I am your host, Joanna O'Neill. Our sponsor for today is TrueCare Treatment Centers. If you or a loved one has a mental health or substance use issue and need help, you can call their 24/7 hotline at 833-203-2848. Again, that's 833-203-2848. Without further ado, I want to introduce you to a very special guest with us here today, Joyce Bosen. Joyce is an incredible soul filled with so much light and so much love. Joyce is the founder and CEO of Trauma Recovery Yoga. Joyce has experienced multiple traumas herself, and those experiences have gifted her with profound empathy. She is drawn to help marginalized populations. Joyce's son died in 2012 in a tragic accident with Joyce at his side. Her desire to help was turbo-boosted. She began to research her PTSD diagnosis and work with other mind-body professionals to create a method that helped relieve her own tormenting symptoms. After counselors observed her improvement, she was asked to teach this method at the vet center, where she herself was receiving talk therapy and quickly found herself very busy teaching at many agencies who needed her style of science-based yoga as a somatic intervention and therapy. Joyce and her husband, Darwin, co-founded Trauma Recovery Yoga, training which has trained hundreds of people in the TRI method. The nonprofit places these trainees in spaces asking for this resource. TRI is now contracted to serve at-risk youth at multiple schools, traumatic brain injury patients, PTSD vets, and overcomers of other traumas such as traumatic grief, sexual assault, and domestic violence. In 2017, Trauma Recovery Yoga was awarded the Compassionate Cities Award by the mayor of Las Vegas after the October 1st shooting for TRI's offering of free classes in 11 locations across the Las Vegas community for those that have been affected. In June of 2018, Trauma Recovery Yoga traveled to Denver, Colorado, representing the city of Las Vegas, who was awarded the All-America Cities Award for their work to bring these self-regulating tools of yoga to the at-risk youth in Las Vegas through their Mindful Movement program. Joyce. Joyce, talk to us a little bit about the mission of TRI, the mission of Trauma Recovery Yoga. What is TRI, and what is it trying to achieve?
I think overall, like our big lofty goal is to foster compassion and empathy where there wasn't, even if it's for someone, their self, right? Mm-hmm. So for others and for themselves post-trauma. And we do this through our trainings. Our style of yoga is a little bit different because you've been to a class, so you know. Yeah, fantastic. Yeah, and you've actually taken the training, so you know. And you were a yoga enthusiast before, mm-hmm. so you know there are differences, and like you said, it's science-based. So mm-hmm. that's the big difference, is that everything's based in science and psychology. We say we speak science, not Sanskrit. Right. And this is part of our mission because it makes it more accessible. And so inclusion and empathy and compassion are all a part of the method. And keeping it science-based allows us to speak to anyone on the subject, right? Absolutely. So we can sit across from the guy at the desk at the VA, and we are not talking about chakras. We're talking about self-regulation, affirmation, visualization, and meditations as tools to help people calm the fight or fight response that our bodies kind of get stuck in post-trauma.
Yeah, and I know from taking your class, I mean, it was such a wonderful experience. And I remember leaving just feeling, it was such a safe environment, and you leave feeling very connected. And I would think that just so many people who have suffered from trauma, you know, are very disconnected, right? So not just disconnected from themselves, from their thoughts, their emotions, their bodies, but other people, right, as well.
Absolutely.
So I felt like, again, there was a lot of that integration between mind, body, and spirit that was going on. Would you say that that's something that happens with a lot of...
said, yeah. And that's, like a lovely side effect, right? Because we're bringing people in to give them tools like the self-regulation pieces to calm the nervous system, the tools that they can use forever, even if they never come to another class, right? But because you bring people together who have experienced different traumas, they begin to feel included in the world. This is what was an accidental, value, because we're bringing people together, and we're calling it trauma recovery yoga, and then we will have like a first responder, a vet, a doctor, people that have vicarious trauma because of their work, like your work. People that experience it directly, or school teachers, or human trafficking survivors, or grieving mothers, right? But we all come together with a similar feeling in our body. And so then we begin to realize that we're all feeling something the same, and we don't have to be segregated and separated. Like, here's where people with eating disorders meet, and here's where people of color meet, because we end up making the world is, my hope is that room where people are connecting, all for different but the same reason, and seeing each other as more alike than different, becomes a microcosm of the world, and it just kind of ripples out.
Oh, absolutely. I've heard you speak before that trauma is a global health epidemic. Can you talk a little bit about what you mean by that, about that health epidemic?
I think that the more and more that we see the people that are showing up with trauma, and what I think, this is my opinion, but I feel like that trauma is the onset or the root cause of so many other diagnoses, right? From addiction to behavioral health issues to eating disorders to other self-serving behaviors, right? Or self-sabotaging behaviors, that we diagnose and medicate those without really seeing that there was a trauma that caused them. And sometimes if we can work on that, this is why I think that trauma is this epidemic that's an underlying cause, and then
at the root, really, the root cause of everything.
Yes, yes. And I think if we start to address the way people's bodies are feeling naturally in a somatic way, with breath and movement, and even just visualization, because we work with a lot of people that cannot move, right? So we work with people who are paralyzed from the quadriplegics and paraplegics and traumatic brain injury patients that work with mirror neurons and visualization and their breath to release those emotions that are trapped post-trauma.
Wonderful, thank you. Can you speak a little bit as to the origins of TRI? How did trauma recovery yoga just come about?
Oh, thanks. Yeah. So post, my son's death, as you mentioned in the beginning, I was diagnosed with PTSD. So I was with him as he passed, and he had lost his legs. He was serving in the Navy. And so I was with him for 9 days as he passed, and then I, a few months later, after isolation, was diagnosed with PTSD. And I didn't want to stay on the medications because I had a life to live.
Sure.
But I also didn't want to be without help. So Xanax and clozapam and things like that were my friend for a while. But I knew that there was something more. I was already a yoga teacher, so I started talking to my traumatologist, my trauma psychologist, the counselors, other people in the mind-body industry and experts, and we took the DSM-5 and we dissected my diagnosis, like symptom by symptom, and then we were like, okay, if breath is this, then let's try this breath. If this, then that, and worked on movement and breath that helped to relieve my symptoms. And so that's where the method itself came from. And then, like you said, I was practicing it for myself.
Yeah.
And then other counselors noticed my progress, and when they were like
it was working.
Yeah, they're like, what are you doing, girl? Because we need to know. We need some of that. And I said, I'm doing this yoga thing. And then they were like, well, can you do it here at the VA with post-combat? Yeah. Can you do it with the amputees? Yeah. Can you do it with traumatic brain injury patients? Yeah. And then there were too many can you do it with and not enough Joyce. So I ended up, then my husband Darwin stepped in and said, girl, we have to teach other people to do. You just can't do this all by yourself. And it was too important. He said, you're onto something, and people need this. So now we have like 400 teachers globally, more than 400, almost 500.
500?
Almost 500, yeah.
Wow.
Globally. And we have Brenda. You met Brenda. I think she's in
Yep.
Greece right now working with Syrian refugees in Greece.
Wow. She's wonderful.
Leland just got, I know. Leland's one of our trainers. He just got back from Europe. He was on a base in Germany teaching.
Wow. So across the globe.
All right. Yeah, it's insane. It's insane. And like I tell you,
That's
I've told you
touching.
before, it's not because I'm brilliant. It's just I'm obedient.
But you are brilliant too.
Oh.
Don't sell yourself
you,
short.
that is so
Yes, exactly. So how would you say the trauma recovery yoga is maybe different than other types of yoga that are being practiced out there?
There are a few forms of trauma-informed yoga that are doing good work. We err on the side of caution to the extreme side of caution. So we don't play music. We don't walk around the room. We don't touch, adjust, or modify any postures. We speak the whole time. We call that micro-cueing. So that no one's left in silence with their pain. And we are directing not only their body, but their mind and emotions the whole time they're on the mat. And everything is based in choice. If you're participating, that doesn't mean you'll necessarily move. You may sit and breathe, and that's participation, right? You showing up, listen, post-trauma showing up in a room is big.
Right.
Showing up in a room with people to do something you've never done before, perhaps, most likely, is huge, is big enough.
Oh, absolutely.
Yeah. So those are the major differences, yeah.
Wonderful. So I know that you and your husband, Darwin, along with several of your teachers, have traveled across the country, kind of what you were talking about, training others in the TRI method. Who are your workshops mostly made up of?
Well, thanks for asking that. That's funny because originally, because I was a yogi, I was a lot of yogis were showing up, yoga teachers, but the impact wasn't there. They weren't really implementing the tools. So we now have CEUs for clinicians like social workers, marriage and family therapists, counselors, and we'll soon have psychologists as well. And that's what's filling up the class now. But it's open to everyone, right? So we also get like wives of vets, wives of first responders and vets, people, anyone who has experienced trauma or wants to help someone who has experienced trauma.
Caregivers. Is
Caregivers, yeah, helpers and healers, yeah.
Absolutely. And then educators, I believe, as well, right?
Yeah.
You go into schools.
We go into schools now. We developed a specific training just for teachers. That's our Mindful Movements program. And we can teach them from chaos to calm for their kids in 90 seconds at their desk, when there's a lockdown or a fire alarm, kids, when everyone gets activated, to bring them back. And these kids in some of the schools that we're in are living in crisis and toxic stress situations that we can't take them out of, but we can give them tools that can help them cope better through those times.
Oh, that's fantastic. What is the youngest?
Kindergarten.
Oh,
Kindergarten
wow.
right now.
Okay.
Actually, we were at we're working with juvenile detention as well, and we had kids there in diapers. We were doing
wow.
walking meditation with them. Yeah.
Wow. How can they do the yoga? So what is it that you're doing
We're-
if they're in diapers?
They're just toddlers. We're walking, and they're following us like little ducks, and we're speaking positive affirmations.
Oh my gosh, that is so sweet. That's fantastic. So that I know that TRI originated in Vegas. I also know that you and your husband have traveled the globe helping others heal from trauma. How many other places across the country are now practicing your technique? I know you've been all around.
Oh, I think I've lost count. I know that the person, Brenda does our social media, and she posted a map the other day and it had all these stars on it. I was like, wow, I don't know. I can't even
So all
answer that.
across the U.S.
We're definitely
Europe.
from coast to coast, and we're in Canada. I think we're not in Mexico yet, not in South America yet, but in Europe as well, yeah. So I've lost count, honestly, yeah.
That's amazing. That just goes to show, again, how this is working, and people really are gravitating towards this because it works.
It's what's lovely, I think, is that how people came together.
Yeah.
And we're stronger together. We know that for sure. And that it's not about, it started out because Jake died and Joyce was in pain, but all these other people came with their pain, and then they wanted to help other people. So it's just insane how it all connected and spread, and it definitely has very little to do with me anymore. This has a life of its own. If I were gone tomorrow, this would continue, and that's the point, right?
Yeah, you said you have 500 teachers now.
Yep. Yeah.
It's incredible.
Yep.
So you kind of touched base on this a little bit. Like, who can benefit from Try Yoga? Do you have to be an experienced yogi? Is it suitable? You kind of mentioned that for those individuals who may be less mobile or not mobile at all, how are they participating in Try Yoga?
So one of my favorite classes I teach is for Driven, which is a neuro recovery space downtown. In our location at the Co-op on 7th and Bridger. And in that space, it's all mobility. So it's a true testament to inclusiveness, right? So we have yogis on a mat. We have some of our teachers will come to this class, and then we have people sit in chairs because maybe they've had hip surgery. And then we have people that are only able to use their mouth in order to move their chair, right? So I cue in that way, I say, see it, be it, or watch it, because we know that our body believes what our mind sees, and our mind believes what our body tells it, right? So if we're all clinched up and angry, then our body believes that we're angry, and we start to react that way emotionally. And if we visualize that we're happy, or we're opening, we're letting go, like the balloon that you love, those things are true for us emotionally as well, so, and physically. So it can help everyone as much or as little as they want to participate, whatever they're ready for. Everyone, obviously everyone's welcome.
So it really is all inclusive. Yeah, because a lot of times people, I think, feel scared because they're like, I don't know the poses as well as other people do, and do I have to be experienced to be in this class or in this training? So
zero experience needed. And, we don't ask you to pin your foot behind your ear or stand on your head. That's not the kind of yoga. There are no vulnerable postures, and you'll be challenged as much as you choose to be challenged, right? Yeah. And it's not supposed to cause us pain or fear. It's the opposite. Yeah. It's a safe space.
Yeah, very safe. And then what can one expect to leave with after attending one of your trainings or your workshops?
Well, so many different things, right? My intention is that everyone leaves with a new sense of empathy for themselves and the world, and some compassion, believing that everyone has a story, really knowing that is actually true more. And then they'll have tools in self-regulation. They'll have them for themselves in a moment to be able to, people tell me stories all the time. After I took your training, I was assaulted, and I immediately started looking for the four corners of the room. Or I found out my dad died right when the plane landed, and I found my feet on the floor, or I started counting the windows of the airplane. Sorry. But that's why we do what we do, right? Because it can be proactive or reactive. So they're either accumulating tools, so when the bad thing happens, because we're human beings and it's a part of life, bad things are a part of our life.
Absolutely.
So they're prepared, or they have something, they have a resource, right? Or they're recovering and they're plagued by triggers and flashbacks and intrusive memory, that they can not have to bolt out of the grocery store when they occur to them, but they can find their feet on the ground or their breath. So those are I think those are the most valuable thing that everyone will leave it with without a doubt, everyone will have those tools with them. And then they'll also be able to, if they choose to, teach at least a chair practice, a 15-minute chair, because we've added practicum to our training now. So each module has a practicum. So everyone leaves with the ability to teach a 15-minute chair sequence. And if they choose to take it and be able to, and they choose to want to teach the 45-minute sequence on the mat, they'll just need a little bit of mentorship, which is free afterwards, and an audition. So it's open to everyone.
Oh, it's just, again, such a beautiful, beautiful thing that you've created, and brings tears to my eyes just like thinking about it too. It's emotional, and that experience and being there, and again, just from experience, is a very emotional experience as well. There's a lot of vulnerability in that room, and again, that connection that brings us all together.
Yeah.
So it really is a beautiful thing.
Thank you. I'm so glad you were there.
And thank you for having me. Can you give us a snapshot of what a typical class would look like? So what is the role of the instructor? What sort of cues are being provided? What can we expect when we come into your class? What does it look like?
Oh, that's a good question. Well, it's a little bit different even in the way the room is set up. Because we are on the side of caution and being trauma informed, we're very mindful of where the doors are, so that no one's back is to the door. The way the mats are set up, the teacher isn't. There's no hierarchy, so we're not just pushing you to your edge and calling you. All yoga is good yoga. First of all, let me just say that. But not all yoga is great if you've experienced trauma. Yeah. I was yoga averse. Even as a yoga teacher, I wasn't comfortable in a traditional yoga class post-trauma, even though I loved yoga before my trauma. So having the room set up in a certain way so that the teacher isn't calling anyone out individually or making anyone feel chastised, or not as good as the person next to them because this person's being praised, right? All of those things are really important. We set predictability by explaining everything that's going to happen before we begin. So predictability is key.
Creating that safety, again, for people who haven't had predictability maybe in their life, have been in unpredictable.
Well, yeah, and a lot of the spaces we go into, we're going into spaces where people are in treatment one way or another, or they're in, some kind of institution. So they may be in detention or hospital or behavioral health situation or school. And then when we come in, it's part of their program. So it's not as though they opted in. And now I have to make them feel like it's okay. I'm not going to upset you. I'm here to help you. So we have it. We're very strategic on the way we speak, the words we use, that we don't use, how we set up the room, how we prepare everyone for what we're about to do, and give everyone permission just to sit quietly. That's okay too.
And some people, you said, can be on mats, while others can be in a chair if they prefer to be sitting.
Yes, absolutely, because it's not always easy to get up and down off the ground, especially even for people that are fully mobile. Post-trauma, when we isolate, we sit a lot. So getting up and down off the ground, it can be challenging. So,
what about touch? Because I know some teachers will use touch at other yoga places. Is that something that you guys do, or do you not do touch?
We eliminate all touch during the practice. This is because we'd have to walk about, and we also don't know everyone's trauma.
So Joyce, how can one become a teacher for TRI? If they want to become a teacher with TRI, what do they have to do?
It's really simple. Just go on our website, traumarecoveryyoga.org, and just click on trainings or events, and there'll be all of our trainings. So we have one every other month in Las Vegas, and then we have 2 out of the state. So we're all over the United States. They can find us everything on that website. It's easy to sign up. Early bird gives you $100 off the regular price, and that's it. That's how simple it is. After the training, we mentor, and we're good to go.
Oh, fantastic! Are there any last words that you would like people out there to know about TRI? Anything we didn't cover?
No, I think you covered everything. Thank you so much.
Oh, of course, thank you. It truly has been such a pleasure and an honor having you on this show, Joyce. You are an incredible human being, and I really hope to have you back soon with us.
Thank you.
Of course. And I want to just give a quick shout out to our sponsors, TrueCare Treatment Centers. If you or a loved one has a mental health or substance use issue and you need help, you can call their 24/7 hotline at 833-203-2848. Again, that's 833-203-2848. Thank you so much.
This has been Healthcare Sunday on 104.7 KJUL, sponsored by TrueCare Treatment Centers.